Hi, how are you? I'm Dr. White. It's very nice to meet you. Please have a seat. I'm actually very glad you decided to get this examination because not a lot of people know about it, and it's a very important examination. People should do it yearly, but well, not a lot of people know about this, so we have to push it on people a little bit. It's your first time? That's great. I'm very glad you decided to do it. And well, before we start the examination, I want to let you know a little bit about what the cranial nerve exam is about. And also, I'm going to be asking you for a little bit of information, and that's going to be pretty much it. Then we're going to start with the examination, okay? Perfect. The cranial nerve exam is part of a neurological examination, and it looks at any kind of problems or issues you may have with your cranial nerves. For today's examination, I'm going to be checking your sense of sight, your sense of smell, your facial nerves, your sense of hearing, and a little bit more things here and there, but I'm not going to explain them all to you or we'll be here the entire day. This is a very easy procedure and it's practically painless, and it's just a preventative measure. Okay, well, I'm going to start to ask you questions, so let me know when you're ready. Okay, let's get started. First of all, could you please tell me your entire name? How old are you? Yeah, there's a lot of birds today. It's one of the perks of living in the tropics. Your weight, do you know your weight? Yeah? That makes things a lot easier. Okay, and your height? Would you consider yourself to be an active person? Yeah. Oh wow, rock climbing. I love rock climbing. I don't know if I would do that though, because I'm not that strong, but I would certainly love to try. Well, do you have any kids? No. Okay. Have you had any issues lately, like migraines or headaches? No. Have you had any, have you fainted in the last 6 months? No. Do you smoke? Okay. Do you drink regularly? Okay. Perfect. That is about all the information I need for now. And we're going to get started with the examination. First of all, I want to check your eyes. So I'm going to be showing a light on your eye. It's going to be a bit strong, but it's going to be for a very short amount of time, so I hope it's not too uncomfortable. Let me just take out my lamp. Okay, well, I'm going to get very close to you, okay? I'm going to check this eye first. Okay. You're going to see a light. Okay? No. Okay. Can you look up for me, please? Now down. Okay. To the side. To the left side, yeah. Okay. And to the right side. Okay. I'm sorry. I know, it's a little bit uncomfortable. Now we're gonna try the other eye, okay? Can you look up for me? Up. Okay. Now down. Okay. To the side. To the other side. Okay. Great. Okay, perfect. Now I'm going to conduct a very quick eyesight test. You know, the ones that they do when you're gonna get your driver's license. Yeah. I'm guessing you've seen this kinds of tests before. Who hasn't, right? Well, I'm gonna ask you to read for me all the rows that you can read. Obviously, I don't think you're gonna be able to read this 3 lines, but that's okay. That's actually normal. So let's start with the first line. What does it say here? Okay. And this letter? This letter? Great. This one? This one? Okay. Yes. Okay. Oh, you have great eyesight. Okay. And now this one. Do you want to try this one? Yeah, let's go for it. Okay, yes. Very good. Great. And this one. Amazing. Great. Now let's try and do that a little bit quicker, but we're going to cover your left eye for me, okay? Yeah, we're not gonna read this one, so we're just gonna read this one really fast, okay? Great. Now, can you tell me what this letter is? Yes, perfect. And this, that one, yes. Great. Perfect. You're doing such a great job. Well, now let's try and test covering your right eye for me really fast. Okay, great. So this letter, this letter, yes. This one right here, great. Perfect. Okay. Amazing. Okay. This. Perfect. You really are perfect at reading these. I don't think even I can see that good. Well, now I would like for you to do some tests really quick with your eyes. I'm gonna ask you to squint your eyes as hard as you can. Okay, 1, 2. Squint them. Now I want for you to look to your left side completely like that. Like that, exactly. Okay, now do it to the right side like this. Okay, perfect. Now I would like to see how your field of vision is. So I'm going to be showing you my fingers really close to your eyes, and I'm going to be moving one of these fingers, and I want you to tell me which one it is, okay? I'm going to be moving them around to different positions, but I need for you to tell me which one is the one that's moving. Okay, so the first time I'm going to do this is going to be really close to your eyes, like this. Okay. Okay. Amazing. Yes. Perfect. Not really far away. Now I'm going to be checking your scalp to see if there's any kind of bumps in it, and just to see that everything is in order there. So I'm going to be getting really close to you, and I'm going to be feeling your scalp. I'm going to be massaging it and checking for any kind of bumps. So I hope you don't feel too uncomfortable. I'm going to get really close to you. Okay? Let's see. I'm going to be checking this side first. It doesn't seem to have any kind of bumps there. Maybe on the back. On this side. It feels nice, yeah, like a massage. Well, it seems like there are no bumps there, so we're good to go there. Perfect. Now, I'm going to be checking for your sense of smell, and I'm going to be asking you to close your eyes for this one and tell me which scent you're sensing. Okay? So this part is a bit hard, but I'm sure you can pass it and be perfect with it. Okay, so close your eyes. No cheating. The first one. Okay. Inhale. What do you sense? Yeah, it's paprika. Now this one. What do you sense? Inhale. Garlic. Yeah, this one's a pretty easy one. Garlic is very recognizable. Now, this one. Inhale. Perfect, oregano, yes. And now the last one. This is the hardest one. Cumin, wow. You definitely know your spices. Okay. Well, now I'm going to be touching your face. Okay. Your cheeks. I'm going to be asking you to inflate your cheeks like this, and I'm going to be trying to push them inside again. Okay. So inflate your cheeks. Okay, great. Now, I'm going to be asking you to try and frown, and I'm going to be holding your forehead. I'm sorry, I forgot the word. Okay, great. Okay, now frown. Perfect. I'm going to be asking you to try and turn to your right side, and I'm going to be trying to stop you from doing that, okay? Okay, perfect. So, try and look to the right. Perfect. Very strong neck muscles you have there. Now to the other side. Okay, perfect. Now I'm going to be testing your sense of touch. And I'm going to be using this Q-tips, and what I'm going to do is very simple. I'm going to be touching you, you're going to close your eyes, and I'm going to be touching you with one or with two of them, and I need for you to tell me if I'm touching you with one Q-tip or with two Q-tips, okay? So, I'm going to start. Please close your eyes. Okay, perfect. One, Mm-hmm. 2. Great. Not sure? I'll do it again. 2. Mm-hmm. 1. 1. 2. 1. Okay, perfect. That you've been doing really great. I can't even believe it myself. Now I'm going to finally be checking your hearing, and I'm going to be using these keys, and I'm going to be making noises on one side and noises on the other side, and I need for you to tell me which side it is. So you're also going to be closing your eyes for this one. Yeah, I know it's a lot of closing your eyes, but it's for the test. So close your eyes and tell me on what side do you hear the keys. Okay? Perfect. On your right side. Yes. Perfect. Great. Now, I'm going to be, you can open your eyes, that's fine. Don't stay with your eyes closed. I'm going to be making the sound with the keys, and you tell me when you stop hearing the sound, okay? Okay, perfect. Now on the other side. Okay, perfect. Before you go, I also wanted to test your hypoglossal nerve, if you allow me. And it's pretty simple. You're just going to stick your tongue out like this, and you're going to move it from side to side, and I'm going to be trying to push it on the other side with the Q-tip, okay? This is completely sanitary, don't worry. So first I want you to stick it out like this. Now, can you do this to the side? And I'm going to be trying pushing it, okay? Okay. Really hard. Okay. Now the other side. Okay, perfect. Well, you've done amazing. I can't believe it. You have absolutely no issues, which is pretty amazing. But it's also very important to check this every year to see that everything is going well, everything is in check. And I hope this was a fun and enjoyable experience for you. I always try and make my patients feel very comfortable and just not have a bad experience, because I know that going to the doctor is not always very fun. But well, I hope you had a great time, and I'm going to be sending you your test results in about an hour to your email. So finally, could you just give me your email? Okay. Okay, perfect. Well, if you want, we can schedule an appointment for next year, or if you just want to wait, you can just call me whenever you want to after a year has passed, and I'll be more than happy to see you. Well, have a great day.